Pregnancy is an exciting and transformative time, but it can also bring some unexpected changes to your body. One such change that might catch you off guard is pink discharge. If you notice this, it's completely understandable to feel a bit anxious, but rest assured, pink discharge during pregnancy is often completely normal. While it can sometimes signal harmless changes in your body, it's important to know when it's okay and when you might need to seek medical advice. Let's dive into what pink discharge means and what you should be aware of. Pink discharge happens when a small amount of blood mixes with your vaginal discharge, giving it a light pink color. It's common, especially in the early stages of pregnancy, with 15 to 25% of pregnant women experiencing some spotting or light bleeding during their first trimester. Most of the time, this is harmless and doesn't pose any risk, particularly if the discharge is light and doesn't come with pain or heavy bleeding. In fact, it's common to see brown discharge later on, as older blood mixes with your discharge. There are a few common, harmless reasons why you might experience pink discharge during pregnancy. One is implantation bleeding, which occurs when the fertilized egg attaches to the uterine lining. This typically happens about 10 to 14 days after conception and lasts only a day or two. Another common cause is sexual intercourse. Since the cervix is more sensitive during pregnancy, slight irritation from sex can lead to a light pink discharge afterward. Similarly, pelvic exams or cervical checks by your doctor during your pregnancy may also cause light spotting. Near the end of pregnancy, some women experience a bloody show, which is a small amount of pink or brown discharge, signaling that the body is preparing for labor. This is usually perfectly normal. While pink discharge is often harmless, there are times when it can indicate a more serious issue. Miscarriage, for example, often starts with light pink spotting that can turn red and become heavier. If this is accompanied by cramping, back pain, or tissue passing, it's important to contact your doctor right away. Another concern is an ectopic pregnancy, where the fertilized egg implants outside the uterus, typically in a fallopian tube. This can lead to pink or brown discharge, along with sharp pain on one side of the lower abdomen, dizziness, or shoulder pain. Infections, such as bacterial vaginosis, yeast infections, or urinary tract infections, can also cause irritation and pink discharge, often accompanied by itching, burning, or unusual odor. There are also more serious conditions like placenta previa, where the placenta covers the cervix, causing painless bleeding, or placental abruption, where the placenta detaches from the uterine wall, causing sudden, severe bleeding and pain. Both conditions require immediate medical attention. Additionally, preterm labor, molar pregnancies, and cervical insufficiency can all cause pink discharge and may need medical evaluation and intervention. If you experience pink discharge, it's important to monitor the amount and any other symptoms that accompany it. In most cases, especially if it's light and there's no pain, it will resolve on its own. However, to avoid complications, try to limit physical activity, rest as needed, and avoid inserting anything into your vagina, including tampons, unless directed by your doctor. If you're concerned, it's always a good idea to consult with your healthcare provider to get personalized advice. While pink discharge early in pregnancy is usually nothing to worry about, later in pregnancy, it can signal potential complications, so it's essential to take it seriously. If the discharge is heavy, bright red, or accompanied by cramping, pain, dizziness, or fever, it's crucial to contact your doctor immediately. Monitoring your symptoms closely and trusting your instincts will help ensure your health and your baby's health are protected. Remember, every pregnancy is unique, and what's normal for one person may not be for another, so don't hesitate to reach out to your doctor with any questions or concerns. Your peace of mind is important, and it's always better to be safe than sorry.